For the diagnosis of IBS, it is important to rule out red flags. If you have symptoms of IBS, but you do have red flags, you might still have IBS, but I would strongly recommend discussing these with your doctor so that you can have further investigation. The red flags that I'm talking about would be anyone above the age of 50. We recommend colorectal cancer screening, be it either FOBT, so looking out for blood in the stool, fecal immunochemistry testing, a FIT testing, or a colonoscopy, anyone above the age of 50. Also, if there's a family history of colorectal cancer or polyps in a family member less than 60, you could be at a higher risk for colorectal cancer or polyps. Therefore, we would recommend screening at an earlier age. If there's a recent change in bowel habits, and especially symptoms that are affecting you at night, be it diarrhea or waking you up in the middle of the night for abdominal pain, that is not usually something that is typical. Therefore, that's something that you should discuss with your doctors for further investigation. Another criteria would be unintentional weight loss. We don't usually see weight loss with IBS. Therefore, if you do have weight loss, that is something to keep in mind. A family history of Crohn's or colitis or celiac disease is also very important because there's a certain genetic component to these illnesses. And if you have these in your family, then these are things you need to discuss with your doctor. So in your family history, colorectal cancer or polyps, IBD, Crohn's, ulcerative colitis, or celiac disease are things that we should discuss. If you go see, you should discuss with your doctor. When you're seeing your physician or your family doctor and they're examining your abdomen, if they feel a palpable mass, if they feel something when they're examining you, that is something that is not normal and should be investigated further, likely with diagnostic imaging, because IBS is not usually associated with an abdominal mass. Another important red flag is evidence of overt GI bleeding. So passing maroon colored stool or having bloody stools or having melinas or black stools, black tarry smelly stools, this is not normal and that should be investigated further as well. Rectal bleeding, so bright red blood in the toilet bowl, may be coming from hemorrhoids, but I think that warrants further investigation as well. As a gastroenterologist, I've seen patients that were told that they had hemorrhoids for years and then they ended up having a big polyp or rectal cancer. So I think rectal bleeding should also be looked at as well. So bright red blood per rectum, passing maroon colored stool or very dark tarry stools as well. Evidence of iron deficiency on your complete blood count or CBC is not something that is associated with IBS. Therefore, that is something that it should be looked at as well. So these red flags are important. You may still have IBS, but there are things that warrant further investigation with your physician.